I'm extremely grateful to the organizers for the opportunity to interact with you. And I just want to give a glimpse of the future of healthcare in the next 5 years to 7 year horizon. I believe that India will become the first country in the world to dissociate healthcare from wealth. This will happen due to two major changes which are happening in the country. One is rapid digitization of the healthcare platform. There are multiple digital platforms for healthcare is getting developed and they will become robust in the near future. And the second change, what will happen is the every Indian citizen will have some type of a health insurance. Let me talk about the impact of digitization on the healthcare. First of all, healthcare will become totally consumer centric. It will not be revolving around a building called hospital with the halo around it. When you enter the hospital, your experience will be dramatically different. When you enter a hospital today, long queues are very common. And in the near future, when you enter the hospitals, there will be reception, but there will not be receptionist. You will be registering yourself through your mobile app or through a kiosk which is provided by the hospital. When you enter a ICU, you will entering a critical care unit without a intensivist. The most of the senior intensivist will be managing patients remotely because entire decision on the patient care is taken by the data. And whatever data a intensivist can see in the ICU, they can see those data sitting at home. Contrary to the past, today we don't like doctors to touch the patient on a ventilator in the ICU. Only the doctors who are going to perform the procedure on the patient will touch the patient. So if they don't need to touch the patient, they don't need to be there because entire decision is made by the data. So we already have data analytics which will give a risk score of the patient. Based on the risk score, if there is a large ICU with 20, 30 beds, patients with a higher risk score will be in the front row, patient with a lower risk will be at the back door, at the back, and sudden cardiac arrest, what you always hear, will almost disappear from the hospitals because 6 hours before the so-called sudden cardiac arrest, there are a lot of subtle signal patient will start giving. Gradually, the pulse rate starts going up. Gradually, the urine output starts going down. Patient's peripheral temperature goes down. These things a naked eye cannot detect, but the sensors can. So the risk score start going up. When the risk score start going up, automatically they are attended by the doctors. And even if the cardiac arrest happens, it happens when they anticipate the cardiac arrest to happen. So this will happen in the ward and in the ICU. The biggest change, what will happen in the ward, is that patients will not be touching the patients. The nurses will not be touching the patients. Every patient will have a patch which will continuously give the ECG, blood pressure, temperature, oxygen saturation, and all the parameters. There will be TVs in front of the nurses station with all the patient's name, room number, bed number, with the 3 color flags flying, green, orange, and red. When the flag color changes to orange, then only the nurses will go near the bedside and find out what is going on with the patient. Otherwise, nurses will be busy nursing the patient rather than spending their time to check the blood pressure, temperature, respiratory. It's a total wastage of time. Today, when the nurses come to the ward to work, they are totally demotivated staff because they start in the morning, go to one bed, check the blood pressure, temperature, respiratory rate, all the parameters, and they enter into the into their file. That takes about 10 to 15 minutes. And they go to the next bed and the next bed. When they finish 30 patients, it's time for them to do it them all over. These are mundane, boring jobs. And the worst thing is, 12 o'clock at night, when they go to check the patient's blood pressure, first thing what happens is patient wakes up. And the first thing patient does is to scream at the nurses. Nurses don't want to be screamed by every patient at 12 o'clock at night. So they try to avoid doing this. In the process, in Indian hospitals, or when I used to work in England, English hospitals, maximum cardiac arrest happens between 4 o'clock in the morning and around 5, 6 o'clock in the morning. Because at night, patient really doesn't get the monitoring he should get. But all this will be addressed by a very inexpensive reusable patch that will virtually eliminate sudden cardiac arrest in the ward. The smart software will make smarter diagnosis than the doctors. And I keep saying it will happen in 5 years, 7 years, because I don't want my colleagues to shoot me down. It is already happening. There are now applications which are very, very good in interpreting or the diagnosing the patient's problem. Of course, it's not legal yet, but it is a matter of time before, in every country, getting a second opinion from the software will become mandatory before a doctor starts treating the patients. It is not that the software diagnosis doctor has to accept, but he can contest. So when this happens, medical error will come down dramatically. The all the prescriptions written by doctors with the scribbled handwriting which only the pharmacist can decipher will disappear. It will become legally mandatory for every doctor to write the prescription in a digital format. Now, you must be thinking that, oh, these changes will take a long, long time, maybe another 30 years, 50 years. I just want to let you know that 5 years ago, one of the judges in Uttarakhand gave a judgment that in the state of Uttarakhand, no doctor can write the prescription on a paper. It must be on a digital format. Unfortunately, there was no infrastructure available, so the government couldn't implement it. But it is a matter of time. It will become legally mandatory for us to write the prescription only on a digital platform. When a patient needs to see the doctor, first consultation, irrespective of what problem they have, will be online. Every doctor, whether they like it or not, they will be available to the patients. Otherwise, patient will find a doctor who is available. Now, what is the implication? First thing for this to happen, every patient must have their medical records in their own phone. Medical records must be in their phone because today people keep traveling. When you have a medical history of some illness like diabetes or a heart problem or whatever, When you go to a new place, in case you have some medical issue, when you go to the hospital, you may not be in a position to reproduce everything what you have. Whereas your EMR in your phone can give the entire history. And EMR in your phone will help the doctor for an online consultation. The reason why online consultation, telemedicine, did not become popular because doctors didn't have the access to your all the old reports. With you having your medical records online, with click of a button, you can send your reports to the doctor. Doctor will spend 5 minutes going through all your reports, and they will be very comfortable in advising you about the future course of action. They're not nervous about missing something. So that change will happen. It is already happening. The today over 80% of the hospitals across the world do not have electronic medical records because the so-called best electronic medical records, which are generally used in US hospitals, cost millions and millions of dollars. And our hospitals simply cannot afford. So something very unique will happen in India. Large hospital groups like ours, we have spent nearly $100 million in building a very advanced digital platform. And it took us 20 years to develop. And today it is a mature system. About 16% of the heart surgery done in India is done by us. We have no choice. We need to have the digital platform. So at this platform, we started using it. Then we started giving it to charitable hospitals free of cost. So a hospital called Skadda Memorial Hospital in Ranipet in Tamil Nadu, we gave them the software that dramatically changed the entire performance of the hospital. After about 6 months, CEO of the hospital visited me to thank me. After thanking, he asked me a very interesting question. He asked me why I decided to give him the software free of cost. I told him that he couldn't afford to pay for the EMR, it is very expensive. But I asked him a very interesting question. I asked him, by giving you my EMR free of cost, have I become poorer? No. Then I asked him another question. If I didn't give him my EMR, will I become wealthier? No. This is the beauty of converting atoms into bytes. Indian hospitals will develop very, very advanced software, which is very versatile, it will be most advanced, and they will make it available to all the hospitals at a price what they can afford. And if they can't afford, they can give it free of cost, because it doesn't make any difference once the development is made. So all these changes will have massive impact on the clinical outcome, because 67% of the sentinel events happening in the hospital is due to communication failure. This is according to the Joint Commission of US. 67% of the sentinel events. Now, how can you accept the 67% of the sentinel event which leads to the death of the patient is due to communication failure? It is because all the data is lying on the paper, whereas you convert the entire digital platform onto a mobile phone, everything will change. So as an organization, from day one, we decided that we should go for a mobile first strategy for our digital platform, because doctors look at the desktop 5 to 6 times in a day, but they look at their mobile phone 200 times in a day. So it is natural that we develop for the mobile phone, and it's on a cloud. It is available to everyone. All these changes will have a massive impact on the way patients are treated. Patient experience will dramatically change. We now are trying out applications which, when the patient comes to the hospital, instead of doctor taking the history, the bot will take the history. And bot can take the history when the patient at home, and when the patient comes to the hospital, the entire history is available. Doctor will only reconfirm the finding which is taken by the bot. Today in our hospital, when our echoed cardiologist does the echocardiogram, when the patient is lying on the couch, first thing he will tell the patient is that now I am talking to Meda bot, so you don't need to respond. Then, as the doctor is doing the echo, he will keep on reproducing his findings, and the bot will keep on recording it. When the test is done, the report is ready. Doctor will just reconfirm the finding and touch the enter button. The report will go directly to the patient's phone. So in the process, what used to take 6 to 8 hours for a health checkup, we have brought it down to 60 minutes. So there is a tremendous efficiency and the consumer satisfaction. So essentially, we believe, like Amazon, which is one of the world's largest company, doesn't own any of the inventory. Uber doesn't own the car. So the largest hospital groups in the world will not have any beds. It will be a software with few beds attached. This is the kind of a transformation we will see in healthcare, and that will make healthcare accessible to everyone, affordable to everyone, and safer to the patients. And this magic will happen once doctors, nurses, and technicians stop using the pen and paper. That gets replaced by a smart digital platform. And if there is one country which can make it happen, that is India, because we are blessed with brilliant software engineers. All we have to tell them is our problem. They come up with 10 different alternative solutions. We are a truly blessed country. And I'm once again, I want to thank you, all of you, for giving me the opportunity to interact with you today. Thank you.